Elastic neck lift with 3 threads and 4 safety pins. This new lifting technique gives the neck a pleasant shape. With aging, the profile of the cervicomandibular angle is lost. Vertical folds of skin and muscles form in the neck, and, below these, horizontal wrinkles. In elastic plastic surgery, the skin of the cheeks and neck is never dissected. A vertical line is drawn in the center of the neck. 2 small lateral lines are then drawn in correspondence with the vertical projection of the labial commissures. These small lines are drawn on a line that represents the future cervicomandibular fold. The first elastic thread will be implanted between these 2 lines. At the ends of this thread, traction loops will be created. These will eliminate the vertical folds of the skin of the neck. To draw the cervicomandibular angle, the patient is made to bend the neck, and the tissues over the corners of the mandible are pulled upward. This line runs outside the corners of the mandible and reaches the fasciae of Lorey. The return path of the elastic thread reaches the loop of the central elastic thread. The 2 lateral elastic threads are parallel and 1 centimeter apart, or just over 1 centimeter. A local anesthetic is injected. The first central elastic thread, Elasticum EP 3.5 Corpo, is implanted. With a 16G needle, a hole is made on each of the 2 small lines that correspond to the vertical projection of the labial commissures. A clemmer with a fine tip is used to dilate and deepen the holes. The Jano needle is inserted perpendicularly into the entry hole to a depth of just over 5 millimeters. It then travels horizontally along its pathway, partially exiting through the hole at the other end, where it is extracted up to the 5th depth mark. The tip is moved slightly to one side and the needle returns to the entry hole, where it is completely withdrawn. A safety pin is used to hold the thread out of the hole. The 2 ends of the elastic thread are knotted without being placed under traction. A second safety pin holds the elastic thread out of the hole. The 2 lateral elastic threads are now implanted. The operator makes an 8 mm incision behind the earlobe. Using scissors, she detaches the skin immediately above the fascia of Lorey and inserts a retractor. The Jano needle enters the small incision and anchors the elastic thread tangentially to the fascia of Lorey. The needle is partially withdrawn up to the 5th depth mark. It then rotates and follows the pre-established path in the subcutaneous tissue, passing outside the angle of the mandible. Once past the mandible, the 2-tip needle is extracted up to the 5th depth mark. It then rotates and follows the previously drawn line, partially emerging from the hole. The elastic thread is pulled through. The Jano needle is now extracted until just over 5 millimeters is left in the tissue. It then tilts and changes direction to create the traction loop. Once the loop has been created, the Jano needle travels parallel to the previously implanted thread. The distance between the 2 elastic threads is never less than 1 centimeter. The resistance to traction is determined by the tissues situated between the 2 threads. A 3/0 polyester thread is passed through the loops of the central thread and the lateral thread, which are held out of the skin by safety pins. The pins are then removed and the polyester thread is knotted. The knot is pressed in deep with a clemmer. The two threads are now joined. The operator now makes an 8 mm incision behind the contralateral earlobe. Using scissors, he dissects the tissue immediately above the fascia of Lorey. He then inserts a retractor and anchors the elastic thread to the fascia of Lorey. The two-tip needle is withdrawn up to the 5th depth mark. It then inclines and partially emerges below the mandible, external to the mandibular angle. The Jano needle is extracted up to the 5th depth mark. It then rotates and continues along its pathway, partially emerging from the hole of the central thread. The elastic thread is pulled through. The two-tip needle is extracted until just over 5 mm remain in the tissues. It then tilts, creates the traction loop, returns and exits externally to the mandibular angle. The Jano needle is extracted up to the 5th depth mark. It then rotates and partially emerges in the preauricular region. It is again extracted up to the 5th depth mark, inclined and withdrawn through the incision behind the earlobe. The two elastic threads are joined by means of a 3/0 polyester thread, and the safety pins are removed. The knot is pressed deep into the tissue. Under the guidance of a retractor, the two ends of the elastic thread are vigorously pulled and knotted. The small incision behind the earlobe is sutured with a rapidly absorbable thread. The procedure is over. The tissues have been repositioned and the neck has regained its youthful shape. Once colonized by connective cells, the elastic thread will become a ligament, making the result stable. To access this material, you must subscribe to the CRPUB.org medical video journal. Subscription is free and reserved for medical doctors only.